A delay in the delivery of oxygen to a hospital in the city of Peshawar is being blamed for the deaths of several coronavirus patients. They'd relied on oxygen to stay alive at the Khyber Teaching Hospital, but with no backup supply, they died shortly after it was cut. The Minister of Health of the Pashtun province tweeted a preliminary report from the hospital that showed failures in many areas. It cites a lack of oxygen for several months and cylinders not being completely filled. It says this went unnoticed, unsupervised and unchecked. Staff are also absent at the hospital's oxygen plant.
Transparency pe compromise nahi hona chahiye.
There will be no compromise on transparency. Action should be tough and fair and bring back the credibility of the hospital to our masses. We tried our best in making the report public in as little time as possible. This sad incident will help put us in the right direction for the future strategy of healthcare.
Although staff members have been suspended, some analysts say this reflects a government failure to prepare for the pandemic.
This incident reflects carelessness, callousness, criminal negligence. As such, disaster management, one of the essentials is preparedness and then mitigation. In that case, I would say the government of Khyber Pakhtunkhwa in particular and the government of Pakistan have miserably failed as far as preparedness is concerned.
The World Health Organization in November praised Pakistan for its fight against the pandemic, saying it had taken appropriate measures to control infections in May and June. It worked with the country to set up labs and to be able to test 50,000 people a day. But so far, only around 2% of Pakistan's population of around 220 million people has been tested for the virus. Back in Peshawar, as an investigation is underway, many want to know why there were so many failures and how they all seem to go unnoticed. Burdon-Manley, Al Jazeera.